Hello.
Come in.
Hi.
Hello.
Hey, Lisa.
Hi.
I
Hi.
wanted to introduce
Hi, Lisa.
Robin. She's going to be taking over for me for tonight.
Nice
She's going to be
to
a
meet you.
311 nurse.
Okay.
Robin, I wrote your name on the board already.
Alright, Angie will be your LNA.
Okay.
And this is?
This is my sister. She came in from out of town.
Hi, nice to meet you. I'm
Nice
Renee.
meeting you. Hi, Renee.
Hi. So we're going to give bedside report,
Okay.
and we, really interact with the patient and give some information. We're going to ask that you step out at this time,
Okay.
and then we can call you back in when we're done.
Okay.
Is it actually okay if she stays?
Yeah, that's
It's
fine.
okay if she hears
Yeah,
everything.
absolutely. You can stay. When we go to give report on her roommate, we're going to have you step out though.
Okay.
We'll let you know
That
when
makes
you're done. You
sense.
can come back
Okay.
in. Okay?
Thank you.
All right. So let's talk about your day today. So one of the things we're watching with Lisa is that, she had a laminectomy done, L3 to L4 due to spinal stenosis.
Mhm.
You had that done on, what's the date again?
It was 2 days ago.
2 days
well, I
ago.
got here 2 days ago.
Okay. And then after surgery, she developed some shortness of breath and ended up having some respiratory failure, needing to be intubated. They had to put the tube down for about 12 hours. And now, since then, she's stuck on oxygen, and she's not on at home. So the areas that we're watching is that she's got a lot of drainage from her incision, and she did have an episode today where she dropped in therapy. We're trying to wean her off the oxygen, and when they had you off of it, walking, your SATs had dropped down. You're 94% on the 2 liters, she dropped down to 90, so we had to put her back on the 2 liters. So those are the areas that we're watching. Let's see, the other areas today, she is on IV Vanco to treat her pneumonia, so she's on 1 gram. You're on it twice a day. And she's got
And the
a
site looks
pep
good.
lock here on the left. And site looks good, it was benign, she's had no tenderness, it flushed fine. She's due for her IV Vanco at 6 p.m., but she's going to have a trough with a CBC
Okay.
and a BMP, so they're going to draw some blood work. They're going to check your levels for your Vanco and also do some other check, like your, see if what your white count is, just do a basic panel.
Okay.
So those are going to be done. I called the lab at 5:30, so just make sure that those are done before you hang that.
And
Also,
I'll be letting the doctor know about those results, so if
Thank
there's
you.
anything that's out of whack, we'll let you know.
okay. Let's see. The other thing is that your pain. You said you've been trying to keep really on top of your pain today. You reported
Yeah.
it about an 8.
That was the highest that it got.
Okay.
But after the medicine, it went down to about a 3 or a 4.
And she's on oxycodone. She can have 5 to 10, so she took 10 milligrams about 12:30, and also gave her 5 milligrams of Flexeril. I think it was about 10:30. She can have that every 8 hours. So she's due next at 4:30.
Yeah.
So assess for pain meds there. And she's on Venodyne. She's not on any chemical DVT prophylaxis because of the spine surgery. So we talked about the importance of keeping those on to prevent any type of blood clots.
Yeah, they're really warm.
Yeah.
They can be. If we take off your socks, it might help you feel a little
Okay.
cooler.
I'll think about it.
The other thing is her back incision. So her incision has been having some good amounts of drainage to it, and we've been having to change the dressing probably about once a shift. I did it last about 10 this morning. I did put a call out to your surgeon, Dr. T, just to notify him, and we want to make sure that he's okay. Doesn't look like
Okay.
any signs and symptoms of infection, but we want to be safe. So Robin, hopefully he'll be calling back a little bit. His office said he was in surgery and he'd be out later.
Okay.
So we want to look at that. Her rest of her vitals have been fine today. Her lungs are dim. They did note you had some coughing on 11 to 7. So also when you call the doctor for those labs, if maybe you can ask for an as-needed cough syrup if you have any coughing
That would be
overnight.
good. Also, I dropped my incentive
Oh.
thing.
Spirometer?
Yeah.
We can get you another one.
Absolutely.
Okay.
The other thing we want to talk about is she does have a nicotine patch that's on. So we have it on your left. Yeah.
Okay.
So she is a smoker. We say about a pack a day prior to your surgery.
Yeah.
So we talked about whether or not hopefully this will cease it and she'll go back smoking or not. We're hoping no.
We'll see.
We'll see. Yeah.
We'll see. Let's just say I really want to come off of oxygen before I go home.
Yeah.
Well, I'm sure we can manage that.
Yeah.
But we would like you to give some good consideration to not smoking. It's one of
I
the
will.
best things you can do for your overall health.
Okay.
So we did talk about if she did smoke that she has to take that patch off. That is going to be very dangerous and deadly to smoke with that on. Let's see. She has a PRN of epidural treatment. She has not needed that. Bowels. When's your last time with your bowels?
This morning.
This morning.
Yeah.
Great. And you've
And
been
it was
avoiding
okay.
It was
no,
okay.
No,
Yeah.
no, it wasn't hard. Because
No.
sometimes these heavy-duty narcotics that we use for pain. Although they handle the pain very well, they
Yeah.
can definitely contribute to constipation.
Okay.
We don't want you to get to that, so we have things we can put in place if that starts to happen.
Okay.
So,
It hasn't yet.
Okay. Yeah, did you think of anything else that I might have missed?
No.
No? Okay.
all right then. Someone will be back in about an hour to check on you, see if you need anything, and you let me know about your pain. We'll
I
try to
will.
keep
I
on
think
top of that.
I think I will definitely want something at 4:30 because it was a long day with therapy. They keep me really busy here.
Okay, I'll
Looks like
check
I
on
have
that for you.
another
Bring
long
that
day
back at
coming up.
4:30.
Okay, so just to recap the things that we
Yes,
talked about for
so-
you to do tonight.
We talked about how your goal is to get off the oxygen, so we want to promote, you know, your pulmonary, your respiratory health. So you want to cough, deep breathe, and more importantly than anything else, you want to move around.
Okay.
So we want to stay out of bed as much as we can
Okay.
and walk as much as we can. And also we're going to stay ahead of your pain. You're going to let me know what you're feeling, when you're feeling it, and we're going to redo that as needed. We're going to keep an eye on your IV site. We're going to draw a trough level and CBCBMP, and I'm going to call Dr. Tai with the results as well as an update for him on the amount of drainage from the incision. Did I miss anything?
No, I think that's about it. And then just the PRN cough syrup. When you
Oh,
position
yes,
it,
when I
things
call
like
him.
that.
Thank you.
Great.
Yeah.
All right, Lisa, it was nice working with you today.
It was nice to meet you.
And
Nice to
maybe
meet
I'll see
you
you
too.
tomorrow.
Okay.
Someone will be back probably in about an hour approximately to check on you. But if you need anything in the meantime, give us a ring.
I will.
Okay.
Thank you.
Great.
Thank you.
Thanks. Nice to meet you.
Nice meeting you.
Hey, Melissa.
Hi.
Hi. Have you had Mr. Spade before?
No, I haven't.
Okay. So Mr. Spade, so he's a watcher.
Okay.
Just so you know, things that we're watching is he's really on strict INO. He had some short-term dialysis in acute care hospital, which he hasn't had it here, but we're really watching his weights and his INO. And he's got some chronic edema, and he hasn't moved his bowels in 3 days.
Okay.
So Mr. Spade is 63. He was admitted to us on the 28th after being found on the floor at home. He was on the floor for 4 days from a fall. He didn't suffer any injuries from the fall. He lives alone. He suffered rhabdomyolysis and had acute renal failure, which required dialysis.
Okay.
He does still have a testio in his right chest wall. Dressing's intact. So it's been like 10 days since he's had dialysis. Has a history of AFib, he's on Coumadin, he's therapeutic right now at 2.2. He does have a recent DVT in his right lower extremity. He's also a type 2 diabetic, and at home he only uses oral agents, but because of his renal failure, he's now on Cytoskil Novolog and Landis. So we've been working with that with him.
Okay.
Put it for his nursing goals.
Okay.
So he does have a pen. We did it this afternoon with lunchtime. And he did pretty good.
Okay.
He was 172 before lunch, so he required, I think it was about 3 units of insulin, and he was able to give himself it with
Okay.
some like cues. He needed cues. What else? His skin is pretty much intact. He's got no redness or open areas, but we're encouraging him to turn side to side because he's at high risk because of his edema and stuff. And we're offloading his heels. He a lot of times pulls the pillow out, so we have to keep going and just re-educating him about that. He does complain of back pain and some right lower extremity pain. So this morning he was about a 7, and at 1 I gave him 10 of Oxy with good relief. He came down to a 3. Like I said, we've been elevating his legs. This morning his lower extremities were trace edema, but the last time I checked with the last rounds he was about a +1, just from being up in the chair all day. His appetite has been pretty good. So for his strict INO, he's had about 1,200 cc's in for the day, and it's in the INO, and he's had about 950 cc's of output. We've also doing daily weights, and his weights have been pretty stable in the last 3 days. Today he was up a half a pound, which we're just watching. Like I said, his blood sugars were pretty good. He was 156 before breakfast, 172 before lunch. He has been ringing appropriately, but he is really deemed a high risk just from his fall risk, so we're continuing with the bed and chair alarm, just really encouraging him to use the, excuse me, call light. What else? He's continent of bladder. He has been using the urinal.
Okay.
but it's his bowels. So he hasn't moved his bowels in 3 days. His abdomen is soft. He's not really complaining of anything, but it is distended.
Okay.
So
have you given him anything?
he does not have any. I have not given him anything.
Okay.
He has orders that if he doesn't go by 6 p.m., that you'll have to give him medications
Okay.
and a suppository.
Okay.
Let's see. Anything else that I might have? Let me give you an action list of what you are to do for tonight. So we need to continue the strict INO.
Mm-hmm.
Also, he had labs. I didn't mention that. So he did have labs today. He had a BNP, and we need those to be called to his nephrologist, Dr. Rao. Okay. So there's some concern that depending on his kidney function, he might have to go back on dialysis. Also, please give Dr. Rao, she wants his tallies of his INO and his daily weights. And like I said, if he hasn't moved his bowels by 6 p.m., he has orders to receive, I think it's lactulose and then a suppository. And then when you do his insulin tonight, if you can continue the teaching with the Novolog and the Lantus, and just elevate his legs for the lower extremity edema.
Okay. Sounds good. So let's just go back over this. So he had a fall at home.
Mm-hmm.
He had rhabdomyolysis. He had acute renal failure.
Mm-hmm.
He had been on dialysis but has not been on for the last 10 days.
Mm-hmm.
He has a testicle on his right chest wall. This dressing is intact, so I will check on that dressing later. He's on Coumadin for his AFib, and his INR today was 2.2.
Mm-hmm.
Okay, and he also has a DVT in the right leg
Yeah.
for that. And it's on the Coumadin also. He's diabetic, and we're going to check his blood sugars at meal and at bedtime, and he needs to continue to learn his insulin.
Correct.
He had some labs drawn, and I will follow up with Dr. Rao regarding the labs, and she would also like a tally of the INO and the weight.
Correct.
Today's weight, which he's only up about a half a pound, is that what you said?
Correct, yep.
Okay, we'll continue on the INO and monitor his legs for the edema, which you said he only had a trace earlier.
Yeah.
Okay.
And it's up to a +1 now, since it's later in the day.
Okay, so we'll check on that.
Mm-hmm.
And then he needs a suppository if he has not had a BM by 6 p.m.
Correct.
Is that correct?
Yep.
Okay, anything I missed?
Nope, I think that's it.
Okay, let me just change the list here.
Alrighty.
Okay. And put that time there. Should we add daily rates to the nursing goal, just as a little
Sure.
reminder on there?
Great.
Okay, yep.
Alright.
Alright,
Awesome.
sounds good.
Alright.
Thank you.
You're welcome.
Who's got that right there?
Hey Melissa.
Hi.
Hi, have you had Mr. Spade before?
No, but I read the codex, don't worry
Okay.
about it, yeah.
Alright,
All right.
yeah, so he's had a pretty uneventful day. He's attended therapies, his vitals have been stable. He's a diabetic, so I did get his blood sugar before lunch.
Okay.
It was 172, he had
All right.
insulin.
Yeah, don't worry, I can look at the mark for that.
Okay.
Don't worry about that.
What else? He's got some lower extremity edema that we're watching. He's on Coumadin. I don't know what his INR
Yeah,
is.
okay.
No, I don't know if they've written an order or not, but
Okay. Does he have his Coumadin orders yet?
I don't know. Haven't been able to get to the chart. Like I said, vitals are stable. His lungs were
Alright.
clear. I know. He had some labs today, so you want to check on that.
Okay.
He definitely had some labs.
We didn't get results yet?
No, haven't seen anything back.
Okay.
What else? What else can I tell you? Like I said, it's been a pretty uneventful day. He takes his meds whole with water. He seemed to eat well. He didn't really he did complain of some back pain. I gave him Oxy. I can't remember the time. Sometime around
Alright.
lunchtime. And he did say it worked
Alright.
pretty good. But I think that's it.
Okay, yep, sounds good. Alright, I'll check them out later when I get around to it.
Alrighty.
Alrighty, thanks.
Spades and therapy. Have you had it before?
Yeah, I think I have. I can look at
Okay,
the codex.
so you
Yeah,
can read
that's
the
fine.
codex.
Yep, whatever. Yeah.
Yeah, he's had an uneventful day.
Okay.
Vital signs were fine. To
Okay.
be honest with you, he was in therapy all day. I hardly even saw him. I gave him his meds. he did get some blood sugar before lunch, I gave it to him, he got a
Okay.
sliding scale,
Alright.
but I've had a crazy day. And
Okay.
we got like, what, 6 other patients to
Okay,
go through?
let's move on, let's go.
Okay.
Yeah, I can look at the cards, I'm
Okay,
good.
alright.
Yeah.
She's 44, she had back surgery following
So, Lammy?
Lammy,
Yeah,
had some
okay.
respiratory failure.
Alright.
She's on IV Vanco for pneumonia, so
Okay.
I'm not quite sure what time we have to give it, but it's given on your time.
Alright.
She's also gonna have some labs drawn then too, so make sure that you follow up with that. We're weaning her O2. Today she had a drop in her stat, monitoring her back incision. She's got some drainage there.
Hey, do you think you could turn down the TV over there?
Excuse me?
Can you get her some headphones maybe?
Sure. Yeah, we'll get her back.
Yeah, well, we're in the middle of
She
a
kept me all
report.
night.
We're in the middle of a report right now,
All
okay,
night.
so we'll get to
She
you
kept
in
me
a
up
minute.
all night with that
Anyway,
TV.
continue.
Okay. Continent bowel and bladder, moved her bowels, and pain issues. So she's due for pain medicine. I think about 4:30. Okay.
Yep, sounds good.
Okay.
Alright, let's get to the next one.
Okay. Yeah, we'll give her some headphones.
Okay, thanks. So it's, like doing TV.
Okay, what do you got for me?
Okay, so Lisa Lovely, that's bed 2. She's 44. She was admitted
Yep,
back
I
there
know
on the
her.
16th.
I've had her
Okay.
before, yep.
So pretty uneventful day. Monitoring her back incision.
I'm looking for Sam Smith.
Excuse me,
brother.
What?
Yeah, you just check out the desk, we're doing
Yeah,
report
the
right
secretary
now.
at the desk can help you with that. All right.
Jeez, people don't even think.
She's on oxygen. We're trying to get her off of it. She takes oxy for pain.
Well, she smokes, right?
She's a smoker.
Wow,
Yeah.
what is that?
Yep. Alert and oriented. Take her meds full with water. Pretty uneventful day. Didn't really have to do much for her. Like I said, I changed the dressing, so you might want to look at it because there was a lot of drainage. Oh, and I put a call into the doctor, so he might call you back.
Alright, great.
Okay. And they have IV Vanco tonight, so there is a trough.
And you didn't get the result?
No, it has to be drawn on your time. Oh, and the CBC and the BMP was added, so and the doctor wants me to call, so make sure you call. Great, great.